Welcome back, everyone. Well, recently we showed you a new procedure that gets rid of fat in those trouble spots like the muffin top without any surgery. CoolSculpt is a procedure that freezes off your fat. It's FDA cleared and can be done on your lunch hour without any surgery. Actually, watch this. So you can walk out without any downtime. Now, we got a lot of questions after this aired, so we wanted to invite Dr. Jennifer Pennoyer back, a dermatologist in Bloomfield, you're the first person really to bring CoolSculpt to the state of Connecticut, so thanks for coming to answer the questions.
Thank you.
So I think after the story, I'd be like, okay, tell me more about CoolSculpt. Does it really work? So I wanted to bring you back and say, number one, who's a good candidate for this procedure?
Really anybody who has a resistant fat area, like a muffin top, the inner thighs, the bra fat even.
Ooh,
any of those, you know, after a baby you can have that little roll there. Any of those spots that no matter how much you exercise and diet, those aren't going away. That's a perfect candidate for us.
And when this, I remember seeing it, I mean, it actually freezes the fat cells. Exactly. So what happens to those fat cells?
Your body is going to naturally take away those fat cells. It's based on the whole premise that the fat cells freeze before the skin. You are born with a certain number of fat cells. Those expand and contract as you gain or lose weight over the course of your lifetime. So once we've frozen those, your body is going to naturally take those away over 4 months.
Yep.
And those are gone. If you were to gain weight, it's gone forever. When you gain weight, you won't gain it back in those problem areas.
It's going to, hopefully you don't gain it at all, but if it comes back, it's not going there.
Exactly.
It's not going there. Okay. So, and how would it compare to liposuction?
Liposuction is a surgical procedure with downtime, and it's invasive. You've got, you know, a lot of healing to do afterwards, and you're under anesthesia. You're wide awake for this procedure, and it takes an hour in the office with no downtime. You can go back to work. And
the other question that had just popped up, how long do these results last?
They're going to last forever because we've gotten rid of that fat.
Yeah, so
whatever I get in that machine, 25% of those fat cells will be gone.
So unlike a filler or something like that where you're going back every 6 months for Botox or you're going back every 18 months for something else, this is, once those fat cells are gone, they're gone. Okay, so I know the other question I was getting a lot. How much does this, well, how many visits are recommended?
Most people do one visit. And get that roll or that fat pad, and then they can find other places where they want to treat. You could do a second visit on that, but you'd have to wait that 4 months. And the prices start at $750 for the smaller areas, to up to $1,500 for the bigger whole belly.
So one roll could be about $750, but that is a one-time cost because, as you laugh. Yes, how much does it cost to get rid of the muffin top? Well, so $750, but that might be the only time you ever go because those are gone for good once they're gone.
That's correct.
And this is FDA cleared, so it's safe.
Safe.
Can I ask a quick question? Do you have to be at your ideal weight when we come to see you? You shouldn't be overweight, right? You should be at your ideal weight, and then whatever's left that you can't get rid of, that's what you're trying to freeze?
We see a lot of different people come. It should be ideally at your ideal weight, yes. But I do see a lot of people who come and get that one problem area taken care of, and that sort of jumpstarts them to do the exercise, to go on and do more.
Okay, good.
So I've seen both ways.
Right. It's not something to treat obesity, but certainly you don't have to be your perfect size to be getting this done, or you don't even need it. Yeah.
Right. Correct.
All right. So we're going to link you to betterct.com, but we can go see Dr. Pennoyer, who is a dermatologist in Bloomfield, and it's really, I mean, I watched it get done. The model, she's not a model, but the patient was actually just watching her iPad the whole time, so it doesn't hurt.
No.
Interesting. All right, there you go. Everything you ever wanted to know about freezing off your muffin top, Scott.